Hi everyone. In this video, we're going to cover all the most important things you need to know about taking fluoxetine, also known as Prozac. We're going to cover side effects, who can't take the medicine, how it works, what it's used for, dosing, how long it takes to start working, what to monitor while taking it, and some special considerations I think are important to know. My name is Mattias Hartmann. I'm a physician associate, board certified in psychiatry, and I work full-time in psychiatry. I make these videos for everyday people like yourself who want to better understand depression treatments, and medications. Let's start off with the common side effects of Prozac. Sexual dysfunction is the most common one at 54 to 63%, trouble sleeping at 10 to 33%, nausea at 12 to 29%, headache 21%, low energy or fatigue at 9 to 21%, diarrhea 8 to 18%, sleepiness at 5 to 17%, decreased appetite 4 to 17%, anxiety at 6 to 15%, tremor 3 to 13%, dry mouth at 9 to 12%. Here are some less common side effects. Reflux at 6 to 10%, dizziness 9%, sweating 7 to 8%, constipation 5%, rash at 2 to 6%, strange dreams 5%. And remember, side effects when taking any psychiatric medicine, they usually come on early. Not every side effect, but most of them, they usually come on early, but the benefits don't come on for a few weeks. So there's a crossover. Usually side effects happen in the first few days, and they usually go away in a few weeks, whereas the benefits, the improvement in depression, improvement in anxiety, etc., usually don't happen in the first few days, and they come on a few weeks later. So when the benefits come, usually the side effects go away. Next, we'll go over some rare but dangerous side effects. Seizures can happen. Mania can happen. Now, Prozac, also known as fluoxetine, doesn't cause bipolar disorder. Mania can happen if someone takes Prozac and they already have the genes, they're already predisposed to develop bipolar disorder, meaning no matter what we did, they were going to show signs of bipolar disorder at some point in their life. Prozac can trigger people to have a manic episode. Prozac doesn't cause bipolar disorder, but it can have people show signs of mania who were going to develop bipolar disorder anyway at some point. Suicidal thoughts can happen. It's rare. It's about 1%. I have a video on that goes a lot more in depth on my channel. So if you're interested in that, be sure to check that out. Serotonin syndrome can happen. Usually it's if you combine several medicines that increase serotonin, then you can develop a serotonin syndrome. And low sodium can also happen, usually in the elderly over 65. So who can't take Prozac? What are the contraindications? If you're taking a monoamine oxidase inhibitor, remember we talked about serotonin syndrome. The reason it's a contraindication is because if you're taking an MAOI plus sertraline, the risk of getting developing serotonin syndrome is a lot higher. If you're taking thioridazine, if you're taking pimozide, if you're taking tamoxifen, or if you have an allergy to fluoxetine, like any medicine. If you have an allergy, don't take it. So how does fluoxetine work for depression? Well, it works mainly as a selective serotonin reuptake inhibitor, so SSRI. It also has some weaker effects on 5-HT2C, so it blocks 5-HT2C. 5-HT just means serotonin. 2C is a specific serotonin receptor. And it also works very weakly as a norepinephrine reuptake inhibitor. So what is Prozac used for? Well, let's go over its FDA approvals first. It's FDA approved for major depressive disorder in people older than 8 years old, as well as several others: OCD, premenstrual dysphoric disorder, bulimia, and panic disorder. These are all FDA approvals. But it's also used off-label for many conditions. These are just a few. Social anxiety, also known as social phobia, generalized anxiety disorder, PTSD, post-traumatic stress disorder, and many others as well. So how is fluoxetine, also known as Prozac, dosed for depression? The starting dose is 20 milligrams, usually dosed in the morning. It can interfere with sleep for some people, so usually that's why it's dosed in the morning. The usual dose range is anywhere from 20 to 80 milligrams daily for depression. And what is the max dose of Prozac Well, usually it's 80 milligrams daily, like the usual dose range there for depression. OCD, however, the doses are a lot higher, and that's for really most of the medicines, like serotonin reuptake inhibitors. For OCD, you do need higher doses, so you can go up to 120 milligrams for OCD, and that's considered super therapeutic dosing. So how long does Prozac take to start working for depression? Well, about 2 to 4 weeks, and that's about the same as most antidepressant medicines, except for a few like Auvelity or ketamine, but it can take up to 6 to 8 weeks to notice more of those improvements sometimes. However, you can notice some increased energy within a few days sometimes, and that's probably due to the mechanism of norepinephrine reuptake inhibition that we discussed earlier. Is there anything you need to monitor while taking fluoxetine, also known as Prozac? No, not really. Nothing if you're a healthy individual and you don't have any medical problems. Lastly, let's go over some special considerations for Prozac. One of the benefits is it has little to no weight gain, whereas some of the other ones like Lexapro or sertraline might be in the little to moderate weight gain category. You can miss a dose with Prozac and you'll probably feel just fine. That's another one of the benefits, is because it has such a long half-life. So you take one dose of the medicine and the medicine stays in your body for quite a long time, whereas some of the other medicines you might miss a dose and you might notice withdrawal side effects. So that's another plus of Prozac if you accidentally miss a dose. Obviously, for it to work well and to work optimally, you try not to miss any doses, but everyone misses a dose here and there. You can get a blood level, so that's a positive. You can actually get a blood level on most antidepressants as well. There is a liquid as well, so not every medicine has a liquid as well as tablets, but if you can't swallow pills, a liquid exists, which is nice. It does inhibit these enzymes in the liver, so if you are combining these with other psychiatric medicines, you do need to be a little careful because it could increase blood levels of certain medicines. Not something you need to be specifically concerned about. That's something your psychiatric provider is going to look at anyway, but it's not as easy as taking something like Lexapro, which might not have as many interactions. So something to consider. It's fine to take with kidney problems, which is great. You do need a lower dose if you have some liver problems, and it's safe in people with heart problems, so those are some benefits as well. If you enjoyed this video, be sure to check out this video next on screen where I go over Lexapro, also known as escitalopram, which is also a first-line medicine for depression, and I go over all the most important things you need to know. I'll see you over there.